Hello everyone, today I will be presenting my interview with an informatics nurse. I will be introducing you to who she is, talk about her education and experiences, the value of informatics, safe practices, technologies that improve patient care, data utilization, magnet journey, information technology, and the personal question I chose to ask her. The name of my informatics nurse is Jeanette Yevsky. She is a RN, MN, CMSRN, and she works at Long Beach Memorial. So the first question I asked her was, describe your career path to your current position, including information about education, certification, and experiences. So she obtained her master's degree in 1984 with a minor in education. And since then, she was working as a CNS for a few years. She didn't like the role, so a clinical educator position opened up at her hospital in 1993. So she thought she'd try the role and see if she liked it. And she did, and she's been in that position ever since. She has her CMSRN, which stands for Certified Med-Surg RN, and she's attended conferences on teaching, so therefore she's able to teach nursing students at Cal State Long Beach. The next question I asked her was, discuss the value of informatics as a driving force in the delivery of nursing care at your facility. So at our facility, we use electric charting, and it's called the EPIC system. It allows nurses to streamline some aspects of charting, and the system does give prompts if you miss something. It can remind you of medication that's due or treatment that is due. Charting can be a lot on the EPIC system, but they do a lot of quality measures along with the patient care. Next, we moved on to what safeguards and decision-making support tools are embedded in the patient care technologies and information systems that support safe practices at your facility. So the EPIC system has many alerts, especially in the medication section. So you can tell if the scan medication was the wrong med, or if the wrong time the med was given, or if it's the wrong dose. Things like that, the system will alert you. Another thing that we have for safeguarding is a second nurse sign off for certain medications. So 2 nurses have to sign off for particular medications, for example, heparin and insulin, just to ensure that their patient is getting the correct dose. Also, once we're entering certain information, septic alerts can let you know that the patient is becoming septic. That way you can put in orders properly and let the physician know that the patient is becoming septic. We also have a brain function system that reminds you to do pain assessments or any other task that you decide to put for yourself, and you can use that as like a to-do list. Another safety feature we have is alerts when patients are high risk for falls or have high risk for skin breakdown. So that way you can implement the correct measures. Next question I asked her was, tell me about the patient care technologies that have improved patient care at your facility. So again, we use an electronic charting system, and it is the EPIC system. She also mentioned that they have iPads to obtain medical consents, and they can also use another iPad that can take photos of the skin and uploads directly into the patient chart. Patients also have access to My Chart. This is an app or a website that you can use that patients create with a login, and they can see their labs, their doctor's notes, their appointments, and things like that on there. Lastly, we have telemetry monitors. This is worn by the patients. at all times, and their heart is monitored 24/7, and strips are printed out every 4 hours. That way, if there's any changes, the doctors can be aware right away. The next question is, what group of healthcare workers rely on you to collect high quality information or data, and how is it utilized? So in this case, she said that she does audits for multiple groups. This includes infection control audits, and then this information is used to see how they're doing following the policies and their compliance with hand hygiene. She also do audits of charting compliance on multiple things, and the information goes directly to the quality department and is used for various things. And risk management sometimes need the data, so she for specific issues, so she gives them that information. And restraint usage, which is a big thing in their facility, and they can use that for daily audits and numbers, and also compliance with policy that goes to quality. Is your organization going on a magnet journey? If so, please explain, and what is your role in this? So at this time, Long Beach Memorial is currently a magnet facility, and they are going on their 3rd renewal later this year. Jeanette's role is to assist staff in getting ready for the survey, and this will happen if the document is approved. Also, she also helps write and edit stories, and submit the documents. And she encourages the staff to obtain professional certification, and these are all things that the magnet is looking for. What is your working relationship with the information technology department at your organization? So for Jeanette, her main role is to teach new upgrades and implement new products, and then she has to give information, give her opinion on the new products and that are being considered. Also, she assists in problem-solving issues that have to do with technology that she can help the staff with. So this is the personal question I decided to ask her is, what made you want to stay in the profession for as long as you did? She gave me a few reasons, but I put the most important ones up here. She said that she had great support from the company by upper management, and the nurses also supported her as well. She really enjoyed connecting technology and teaching staff, new staff, current staff, everyone there. She loves teaching. And she also feels like her voice is heard because she is attending the meetings that has to do with information technology purchases. So she's able to trial these new products and give her opinion, so she feels like she's being heard. And lastly, she wants the staff to grow within a company, so she's always pushing for certifications and moving them to specialties as they want to go to. So she just loves her job. She actually retired last year, but she was asked to stay on part-time or per diem just until someone else is able to fill her position. But it's been quite difficult to find another informatics nurse, so she decided to stay on part-time and to help out the company for as long as she can. And that concludes the end of my presentation about my informatics nurse. Thank you.